12 to 30,000 refugees come to Canada every year, and they're escaping war, torture, persecution. And they arrive seeking asylum, after which they have to wait an average of 2 years for their application to resolve. And after that, some types of refugees still aren't applicable for care, even if they're about to die. And so, although hundreds of community organizations and provincial laws exist to help these people in Canada, they're scattered and they're too difficult to find, so they end up being turned away or getting care only when it's too late, and when help is less effective and more expensive. So about 20% of these refugees are children, and 18% are pregnant women without access to prenatal care. Do you guys remember Anna, the pregnant refugee with sickle cell who was worried about her pregnancy complications? She asks frontline workers and community centers for help, but the information is confusing and the resources are difficult to navigate, even for a French or English speaker. So we're building a website that would let frontline workers show refugees where to find help, but more importantly, they can navigate an easy to understand interface that overlays a powerful open source website with elastic search features, and those will learn from the population that they aim to serve and provide the most relevant results to these people. So this would basically increase people's ability, refugees' ability to access primary care timely, and it would save them unnecessary strife. And it would improve health outcomes in life years, especially for refugee children. It would make the difference between a pregnant woman delivering a healthy baby and a sick mother coming to the emergency room seriously ill. So facilitating these connections would also increase the efficacy of the public health system, which is a cost saving. And a night in the ICU costs over $10,000. Anna could have been seen in a clinic for under $500. In the future, the site content will build and improve organically through an interplay between Elasticsearch and user feedback. And we also want to use surveys to integrate frontline workers' experiences and whether or not they're being able to implement this in their clinic to improve and build upon this, and evaluate which improvements to access are attributable to a tool such as this one. So our final goal is basically adoption by frontline refugee facilities and to sponsors who want to transform access to healthcare.
Bravo! Bravo! Yeah. Well, it's a great demo. Great concept. Come on down, the whole team. Est-ce qu'on a des questions? Ben assez de 360 Midlink.
Donc, l'utilisation, c'est surtout pour ici au Canada. Vous avez regardé la possibilité que ça puisse être utilisé ailleurs aussi? In English? No problem.
Oui, en fait, l'idée, c'est de le faire partout au Canada. Donc, c'est sûr qu'on se concentre pour l'instant à Montréal, parce que c'est là qu'on a nos données et nos relations, donc des gens qu'on connaît qui sont dans des fondations pour les réfugiés. Donc, c'est là qu'on va chercher nos informations pour l'instant. Mais c'est sûr qu'on doit compléter toutes ces données, donc de savoir quelles fondations existent et où est-ce qu'ils peuvent aller, et tous les documents légaux, etc. qui doivent faire. Donc, oui, c'est pour implémenter partout au Canada et peut-être même ailleurs. Non, on vise en fait les gens directement, donc les réfugiés directement, mais aussi les personnes qui travaillent avec. Parce que le problème, c'est qu'il y a des community volunteers qui font face à ces gens-là. Donc ces gens-là arrivent qui ne parlent pas français, qui ne parlent pas anglais, mais ils arrivent devant ce volunteer qui, lui, doit essayer de lui expliquer des choses et il n'a pas même pas les bonnes informations nécessairement, ou il ne sait pas où sont les informations et où l'envoyer, la personne. Donc, en fait, c'est ça. Nous, on pensait développer, là, pour au moins 22 langues.
So right now we're limited by the languages that these resources provide their own information in. So we've been getting content. We're still working have a lot of work to do on gathering content, but right now, like, a lot of it is being provided in English and a bit in French. So it really depends on what we get from the clinics right now. But we hope to be able to expand it into other languages and also use pictograms, make use of stuff that doesn't require it.
The pictograms have been studied to be multicultural. So they have the goal is to, even if they don't speak the language, they can touch the pictogram and they're gonna give them places they can go. So even if they don't speak the language, they know where they can have help.
Bravo! 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 Bravo!